Hey guys, Dr. Nick here from HealthSource, and this week for the Spartan Health Tip and Condition of the Week, we're going to be talking about our knees, which I know in most of your minds right away you're thinking, how does that really relate to what we're doing at Spartan? But when you sit or you stand all day, your knee takes a lot of wear and tear as well, and we see this very often in our office as well, simply because the knee is connected to a lot of things. It's connected to our ankle, our feet, it's connected to our hip and our lower back as well. So if one of those areas isn't working well, the knee can be a big problem as well. Now, when we talk about the knee, there's really a couple things that we look at. First and foremost are the muscles that surround the knee. The knee is a very muscular structure in the component that we have big muscles that hook into it, but there's also big tendons as well. So there can be challenges with tightness, muscle spasms, irritation, scar tissue. All of those things can play into the knee. The other challenge is in order for our knee to bend and allow us to go through range of motion, what we don't really think about a lot of times, and unless you've had an anatomy course you wouldn't know this, your top part, meaning our upper leg, has to actually transition forward in order to unlock. And a lot of times what we see happen is because people stand or they're on their feet a lot, or they've had an old injury to the knee itself, is that space between the knees gets jammed together. And what that allows or doesn't allow is it doesn't allow that leg to be able to slide freely through the range of motion. So that's where we experience a lot of the pain, the irritation that comes with knees. So a lot of the things that we do with the knee is really designed to open that space back up. It's designed around exercise, strengthening, therapy, but we also can adjust your knee, which sometimes I think people don't necessarily equate chiropractic with knee pain, but we have to allow that joint to move better. And when we do, the knee a lot of times feels significantly better just because of the range of motion is that much improved. So if you have questions, you're having knee pain, there's so many things that you can do to help, but one of the big things, we've talked about this on a couple other things, is get your butts moving. The more you move, the better off you're going to be, whether that's walking, jogging, swimming, riding a bike, whatever it is. Movement in general is one of the best things for the knee. But also remember, it's connected to all the other areas as well, the ankle, the hip, and even the lower back. So if you're having problems in those areas, the knee could be the cause of your problems. Make sure you're getting that checked out as well. Dr. Nick from HealthSource. If you have any problems, get in touch with us.